Next up is Congressman Brian Higgins, incumbent representative for the 26th Congressional District. Congressman.
Sir, how are you?
Loving the look today.
Oh, thank you. I got a little dressed up. I had some events earlier today, and I'm pleased to be with you again.
Well, for the viewers, he's been to quite a few Meet the Candidates days, so he won't be surprised if I say, you got your next 2 or 3 minutes. What would you like to open with?
Well, I don't think there's a more important issue in this election, be it at the congressional level and at the national level, than the assault that this president and this White House is perpetrating against people with pre-existing conditions. 10 years ago, I supported the Affordable Care Act, and I am the first to recognize that it was a highly imperfect piece of legislation. But the context was, for 100 years, both Republicans and Democrats tried to advance healthcare reform with no success. But the one issue in a very complicated bill that dealt with a lot of issues was the one that said that you cannot deny people healthcare coverage, and you cannot charge exorbitant prices for that coverage for people with pre-existing conditions and people with developmental disabilities. That is a pre-existing condition. In many cases, not all, people are born into it. There is a genetic predisposition to that. Before the Affordable Care Act, an insurance company could deny you coverage. Or if you had a dependent parent on whose insurance policy you were included, they could say no because your kid was stuck with a developmental disability. And the irony in all of this is that the newest pre-existing condition is COVID-19. So this administration, through the Supreme Court, is trying to kill the only federal law that protects people, patient protections for pre-existing conditions. And yet, you have a president that in rallies with thousands of people is saying that he protects people with pre-existing conditions. He does not. He does not. Let me tell you the language that he supports. The language that he supports says an insurance company has to cover somebody that has a pre-existing condition, but the policy doesn't have to cover whatever treatments are related to the pre-existing condition. That's not covering people with pre-existing conditions. That's not providing patient protections for people that need protection more than anybody else. And that is a great assault being perpetrated on some 100 million Americans that have pre-existing conditions. This is a very, very important issue. And I support expanded Medicare, expanded Medicaid, because it's important for people with developmental disabilities. But you know what? Medicare and Medicaid always has covered people with pre-existing conditions. This administration and my Republican colleagues in Congress are trying to destroy the one law, the only law in America that protects people with pre-existing conditions.
Okay. First question from our feed. It talks about the stimulus. I know that you're a fan of services with people with disabilities. You've been very supportive on issues with us in the past, so full disclosure for our viewers. But the question they're asking is, how would you facilitate another stimulus? We, people with disabilities, are taking hit on our services now because the state budget has gotten to the point where there's a $50 billion deficit. Yeah. And we're looking for state aid and community aid desperately to fill that gap. But there's a delay in understanding that with regard to the stimulus. So what would you do to facilitate another stimulus?
Let me help put this in proper context. We have a highly contagious infectious disease. In America, we're 5% of the world's population, but we have 25% of the COVID-19 deaths in coronavirus cases. We have a disproportionately high number Americans aren't welcomed in Canada. Americans are not welcomed in 27 European countries for the exact same reason. We're viewed as super spreaders. In those countries, and their leaders at the federal level have an obligation to protect the health and safety of their people. We had a White House that failed in that regard, and it's basically acknowledged. So I voted for the HEROES Act proudly. That was 5 months ago. That provided millions more to states, to counties, to cities that are expected in a time of national emergency to provide the resources to the federal government, or to the local governments. So you have a snowstorm. There's a national emergency declaration made. You have a flood. You have a hurricane. You have a pandemic. The reason why you have a national emergency, because it's the federal government's responsibility to provide the resources to the state and local level directly to respond on behalf of all of our people. So the HEROES Act, we started that bill. We didn't say take it or leave it. That's not how government works. We said it represented a starting point, not an end point. Mitch McConnell in his Republican conference in the United States Senate didn't think it was important enough to take up. They basically ignored it. There was a last-minute effort a couple of weeks ago, probably motivated by the oncoming election, to revive talks about another disaster relief bill, to no avail. And that is a horrible tragedy, and I'll tell you why. This pandemic was a universal gut punch. Everybody was negatively affected by this. Because we failed to make investments in the National Institutes of Health toward developing a vaccine, toward developing a treatment, the only thing that we could do to protect our families and our fellow citizens is to physically distance, to wear a face mask, and to practice good personal hygiene. The coronavirus was the cause of SARS, severe acute respiratory syndrome, 20 years ago. Why did we not invest in the National Institutes of Health, the largest funder of medical research, toward the goal of developing a therapy or a vaccine to avoid that? Had we done that, we wouldn't be dealing with the problem that we are. That we didn't is not the fault of the states, who, as you rightly point to, now have to reduce significantly state funding to programs like Medicaid, to other programs that help the developmentally disabled community throughout New York State, including and especially right here in Western New York. We have made great strides. I have personal experiences with one of the first community residences in all of Western New York in the mid-'70s when my dad was a city council member. He stood up bravely when a lot of people in that community were opposed to that. You don't know why? Because people were fearful and they were exploiting other people's fears. Our property values will go down. These people are dangerous. Well, that passed. And it's on Buffalo Street in South Buffalo, run by People Incorporated. I used to walk door to door when I was running myself many, many years after. I'd ask about how people on the street felt about the community residence run by People Incorporated on Buffalo Street. One guy told me it's the best run household on the street.
Wonderful. That's a great answer. Normally I would have Mark go to the mop-up question, but we don't have an awful lot of time for it. So I want to be able to remind you, as I remind all the other candidates, because you appeared live today, if there are questions that come across the feed for you to answer, I am going to send them for your campaign to respond to. I appreciate the time that you've given us today. Thank you so much for coming. and being patient so that we can technically get you on our feed.
Thank you very much. Keep up the good
Thank
fight.
you.
Good days are in front of us.
Absolutely our pleasure.
Yeah.
Thank you, Congressman.
Thank you. Thanks, everybody.